Thank you all for taking the time to hear about my practicum experience during this socially distanced time. My name is Sierra, and I'm excited to be finishing my degree with the Public Health and Social Policy program at UVic. My area of focus is in Indigenous health. So I'd first like to start by acknowledging and thanking the Coast Salish peoples whose traditional territory I am currently a visitor on. I express my gratitude to the Squamish Nation and Tsleil-Waututh Nation, and I value the opportunity to learn, live, and share educational experiences on this traditional territory. I was fortunate enough to do my practicum with the newly formed nonprofit, the Indigenous Knowledge Keepers and Elders Society, which is also referred to as IKKES. The mission of IKKES is to support the Indigenous knowledge keepers and elders of British Columbia's Lower Mainland, mentoring and utilizing a collaborative approach that includes cultural and traditional teachings and methodologies of their ancestors. IKKES works to meet the needs of the elders through connections with their family and community, to combat barriers from a mental and physical health, safety, and technology lens perspective. The practice scenario I worked on throughout my practicum is helping IKKES connect with the local Lower Mainland community and the elders IKKES is involved with to both involve the community and support the elders. It is very important for IKKES to connect with the elders for relationship building, trust building, helping the elders stay socially connected, and also to know how to best support their needs. It is important for IKKES to connect with the community so as to learn of new ideas for helping the elders, recruit volunteers, and help advocate for elders in the community. Connecting with the community is also important for IKKES because it is such a new nonprofit. It can help with legitimacy of the organization if it has more community connections and is on the pathway to start building a positive reputation within the community. To be successful in my practice scenario, I used many skills from the PHS program because there were so many, but these are three that really stood out to me the most. The skill of written and oral communication means being able to communicate through writing and verbally to successfully articulate messages, information, ideas, and questions to different types of people and groups. To connect more with the community, it was important for IKKES to have a website, but we did not have the funding for this. I used my communication skills to write to local universities' computer science programs to advertise volunteer opportunities to help build the website for free. I now have 4 students building a great website for us for an in-kind donation. The skill of grant funding and management for me includes both searching for grants that are applicable and applying to them. To help IKKES stay connected to the elders during the pandemic and to help the elders, I found a funding opportunity through Fortis BC to help, and I used the grant management skills from the PHS program. I created a project proposal to create an elders care package project, which includes groceries and mood lifting items such as soaps and puzzles. I applied for the funding from Fortis BC and was granted it, which was very exciting. And my supervisor really provided me the space to problem solve, and I was able to realize that this skill could become my strength. I was able to use my other skills to feed problem solving to apply this skill to my practice scenario to help IKKES connect more with the community. I showed this when I was able to find the 4 computer science students to help build that website. And I was also able to use my problem solving skills further to solve or work on the lack of funding issue to connect with Sprottshaw College, who was able to connect us with an administrative student to do an unpaid practicum with IKKES. The concept of cultural safety considers how social and historical contexts with power imbalances shape the health and level of care Indigenous peoples receive. Practicing cultural safety enables the individual receiving the care to decide what is culturally safe and unsafe, allowing the power to shift to the patient. This area was the most important value to me during my practicum, and the area I think I needed to work on the most, but also that I was able to learn the most from. I'm ashamed to say the first I heard of cultural safety and competency was actually at the PHSP orientation week. I feel fortunate that many of my PHSP courses gave me a good base to learn about cultural safety that I was able to carry with me into my practicum, which was extremely vital. I was nervous at first when starting to meet IKES Indigenous members and contacts because I do have very few Indigenous friends and mainly only a student to professor relationship with the Indigenous peoples I've been fortunate enough to meet at UVic. So this was a very new experience for me. What helped me the most to develop my cultural safety skills was to always position myself as a learner and to remember that the Indigenous person I was working with determines the standard of if they feel culturally safe, and that is not up to myself. I was able to develop my cultural safety skills through having the support of an elder who told me I can ask her questions honestly and she can help me. For example, I was not sure how to correctly address an elder, and I was able to ask her, and she was able to explain to me what is culturally appropriate. I felt that being more aware of cultural safety allowed me to connect and build more genuine relationships with Indigenous peoples. One area I would like to continue developing is project coordination and management because I really enjoyed learning about this area in the PHSP program and the experience I had with IKES in project creation. I created my first project proposal for the Elder Care Packages project, and it helped me think more deeply about how many factors go into a project, and I learned that planning is an essential ingredient. I hope to develop this area by continued volunteering with IKES as well as in future jobs and continued reading about this subject area. I just want to say big thanks to Natalie and Betty, the PHSP instructors, as well as all the other amazing instructors. Morgan, my practicum supervisor, and the elders that I met through IKES who made this experience possible and enabled me to learn so much, as well as everyone involved in the PHSP program, particularly all the students who I hope to continue my relationship with. Yeah.